Lisa, we're talking about POP Health today, and I understand that it reports on 44 quality measures at hospitals and clinics. Can you tell me something about these quality measures, why they're important?
Right. The 44 clinical quality measures represent the care that providers are giving to their patients. And individually, they represent a measure of how a provider is giving care to a patient. So, for example, for diabetics, what type of care the diabetics are receiving, and it allows providers the opportunity to measure and evaluate the care they're providing to a large population of their patients. The 44 quality measures represent different types of practices of care, from primary care to certain specialties, and they provide a really good opportunity for providers and doctors to understand how the care that they're providing to patients may be improved.
Now, the idea of POP Health is that this data shouldn't just stay within the hospital, right? It's got to be shared.
So the data, POP Health is actually a tool for physician practices. Right now it is not for hospitals, but it will be expanded likely into the future. But the data is, so a provider may see a number of patients. They may have 1,000 or 2,000 patients that they see as part of their practice. And it allows the patient, the provider, to look at the care that is being provided across their entire population of patients, and to find those opportunities where they can improve the care. So it uses inputs from their electronic medical record systems to produce these quality measures in a way that is automated. It requires very little effort on the provider to run the reports, to interpret the data. It allows the patients, the provider, to dig down and look further for those opportunities to improve the care.
I'm sorry we can't have a demo as part of this video. We'll probably be able to put up some links where people can look at some of these reports and the nice web interface that you've got on that.
Right. The user interface for providers is one of the best features. We've gotten a lot of really positive feedback on how easy it is for the providers to use POP Health. Providers don't have a lot of time. They're very busy seeing patients, and the opportunity to use tools in their provider practice that don't require a lot of time, that don't require training, that allow them to immediately use them and understand how they can use the information that's presented is a real benefit for the provider practices.
And one of the reasons that POP Health is becoming something of a big deal now is that it's very related to meaningful use, which is at the center of the Healthcare Act, and can you say, or rather the Recovery Act that is now part of
Right.
healthcare.
So POP Health is, really two main reasons that POP Health is gaining a lot of enthusiasm right now. First is that it is a tool for providers that gives them access to a wealth of data in their electronic health record systems that they might not normally have available to them, so they can improve care. The other is by evaluating the clinical quality measures as part of the Meaningful Use Program, they're now eligible for incentive payments from the Centers for Medicare and Medicaid Services, CMS. So not only, so through that process of evaluating the clinical quality, they're able to demonstrate that they're meaningfully using their electronic health record systems and the electronic data to improve health care and thus be eligible for incentive payments.
I also understand that the ONC, one of the government agencies under Health and Human Services, they funded the development of POP Health at MITRE, where you work,
Yes.
and it's an open source. So why would MITRE do this for the ONC instead of just leaving it up to the market and private vendors?
There are a couple of reasons why ONC was really interested in developing an open source reference implementation for clinical quality measure reporting. One is that clinical quality measure reporting is really difficult, and for everybody in the nation to be going through this effort to program and to develop software to do this was viewed as really difficult. That ONC really thought by developing a reference implementation that they could speed up the effort within the industry.